When I was in medical school, I did a rotation in Ireland. So my great grandparents are from a little island off way in the west coast of Ireland called Achill Island. And I did this a month-long rotation, a couple of weeks in Dublin and a couple of weeks working with the physicians on Achill. And I went through and I was preparing the talk and I started pulling out some of my old pictures. And this is this little tiny island, and we went snorkeling over there. And I don't know that this was the house that my great grandmother grew up in, but I thought when I got the invite to come to do this talk, I have to admit I had to look up Guernsey, and I thought, oh my gosh, these are my people. It's not that far away. So I'm going to share with you just my experiences and how I tripped into integrative medicine. And doing medicine was something that I always knew I wanted to do. As a kid, I was cutting open everything I could. I was fishing, frogs, whatever it was. I was looking inside and figuring out how it worked. So I also, as a child, I used to get sick. I would get these high fevers every 2 to 3 times a year. And I would get so sick that my mother would have to carry me to the bathroom. I couldn't eat. She would take me into to the doctor's office. He was a GP, and he was this big, heavy, thick accent gentleman, and I would have to get a shot of penicillin. And if you've ever had a shot of penicillin, I mean, I had this vision of him. I'd have to turn over and pull my pants down, and he would go, and then shot of penicillin is like cement going into your thigh. It hurt like crazy. And he never spoke to me. He never looked directly at me. It was such a disempowering experience. And I decided when I was about 7 or 8 that I was going to become a pediatrician and I was going to talk to the kids. And so that's part of my life's work is being a voice for these kids. And it's all about getting to the root of illnesses. So with these illnesses I had, my mother had to push and push and push to get him to send me somewhere to get to the bottom of it. So I went to the Cleveland Clinic and I had a test done, and it turns out I actually have 4 kidneys, and I also have 4 ureters. But what happened is I had a little part of my kidney that was infected most of my young life. And when my immune system would go down, I would get sick, I would get a kidney infection, and I would have to take antibiotics. So after we figured this out, I took antibiotics for 6 months, and then I was fine. I won't get into what that did to my gut flora, having taken antibiotics for 6 months, but I'll talk a little bit more about that later. So my passion of integrative medicine is, let's get to the root of our illness. And it's about good medicine, functional medicine, integrative medicine. Andrew Weil, who I trained with, just talks about practicing good medicine. So having always known that I wanted to be a doctor, much to my chagrin, when I started practicing medicine, this is what I felt like on a day-to-day basis. I felt like I was on a treadmill running from room to room. I was prescribing antibiotics, steroids, and you've heard the people speaking before me. So what would happen is I would give a medication, the kids would get better for 2 weeks, and then they were back in the office 2 weeks later. And I wasn't helping them, and it was extraordinarily frustrating. I was miserable and stressed out. I was in fight or flight all the time. It was always the same kids, and I'm going to describe this because just as Rangan said, it's a continuum, is that all of these things are related. It's these seemingly unrelated issues, but the babies, they start off and they have colic and reflux. Then they get chronic runny nose. They get bumps on the back of their arms, their cheeks, recurrent ear infections. That's a bulging, infected eardrum right there. They have mouth breathing, snoring, big dark circles under their eyes, constipation, abdominal pain, and behavior issues. These are with mood swings. Behavior can be up and down. And what I knew how to do was to treat them symptomatically. I would do antacids, steroids, like I said, antibiotics. And I started getting this, I started to say, wait a minute, there has got to be a different way. So when you look, and I couldn't articulate this back then, but what I started to figure out is we're going to give this child a medication. And it was really when I was prescribing antacid medications to 2-month-old babies that I went, there is something fundamentally wrong with this. So you give an antacid medication. That lowers the defense. Why is this? Okay, we need acid to break down the protein so that we can digest our proteins. We need proteins to make our neurotransmitters. If we don't have our neurotransmitters, then we're going to start to get anxious. We're not going to sleep well. And we're going to be back in the doctor's office for anxiety medications, for antidepressant medications, and on, and then attention deficit disorder medications. So what we need to do, and so healthy kids become healthy adults. So we have to get these issues under control and address the underlying systemic inflammation when they're little, because then it's going to go on, cascade onto all these other things, and then autoimmune diseases. So a small miracle happened one day, and this was shortly after residency. I was seeing a patient that I had been seeing since they were babies, and he had eczema, and mom was breastfeeding him, and she said to me, "You know what, Dr. Kilbane, I went off of dairy, and his eczema improved." And I said, "Oh, interesting. I don't know why that happened, but let me read about it. Stay off the dairy, and then we'll figure out how to get fat and protein and vitamin D into him, when he turns a year of age, and if we need to keep him off of dairy." So meanwhile, he was also getting recurrent ear infections, and he had had so many that we had to refer him to get ear tubes. She really didn't want to get the ear tubes, and some snafu of insurance happened, and she canceled the surgery. And then at this little boy's 1-year well child check, she had had a big omelet the day before, and he had a huge eczema flare. And so we said, "Oh, okay, it's dairy and eggs. So keep both of those out of your diet." But he still had fluid in his ears, which for kids, that can harm your hearing. So I said, "You really need to get this ear tube surgery, but now that we're off of these 2 inflammatory foods, come back in a few weeks, let me look at the ears, and let's see if maybe we can save him from this ear tube surgery." Well, sure enough, 3 weeks later, his ears were perfect, his skin was perfect, and he didn't have any problems after that. So it's just, I've always listened to families, and I've listened to these moms, and moms really have taught me more than many medical books. So once I started to understand these concepts, I was practicing it more and more. So this is a patient who came in. He was about 5, and he had recurrent sinus infections and wheezing. And what happened is one day his wheezing got so bad that he had to have an oral steroid. And he went bazonkers. His behavior was off the charts. So mom knew, I can't give him these oral steroids anymore. It's just not going to work for him. So we went back and we looked through his history, and his previous pediatrician had already done allergy testing on him. So I said, okay, he's got a dust mite allergy, and he's got all the classic signs of a food sensitivity. He had those dark circles. He was sitting on the exam table. He was a mouth breather, sounded like Darth Vader. He was drooling. He didn't sleep well. And so I said, okay, he's clearly got a dairy sensitivity, so we're going to pull him off of dairy. And he's got a dust mite sensitivity, and he's sleeping on a mattress that's 20 years old. It had been his uncle's from when his uncle was in college. We got rid of the mattress, took away dairy, and threw out his asthma medications. So it goes back to just getting to the root of things and practicing medicine the way that we were all trained to. And the way that we're trained is that we should be able to make a diagnosis without ever touching a patient. We should have that clear. So that's what we do in integrative and functional medicine. We take a very thorough history. And it's all about inflammation. So we have systemic inflammation. And it's like, I liken it to a glass of water. So our body is the glass, and the water is the inflammation. We need a certain amount of inflammation, because if you cut your finger, you need to stop the blood flow. And what happens, though, is that we are all so inflamed that we are having symptoms. And that when the inflammation is overflowing, that's when we have symptoms. So what we do is I say, okay, so if this child maybe they have a tree allergy and a dairy sensitivity. And we say, okay, we can't cut down all the trees, so let's pull out the dairy, decrease their cup of water so where it's only a fourth or a half full. And then when we get that seasonal variation, we're not going to have nearly the allergy symptoms that we would have previously. And I have seen this, so this just kept happening, is that these kids were getting better and better. And so I started to just kind of go, is this a fluke? Is this really happening? Or is this why is this happening? And so it became then to me that food was the elephant in the room, and but I couldn't ignore it anymore. But I still thought, well, where's the science? Why didn't I learn any of this? And meanwhile, my partners are saying to me, what's that voodoo medicine you're doing, Sheila? But a year later, they were saying, okay, what are the dose of those probiotics? So I ended up going on and doing more formal training with Dr. Andrew Weil, and that's where I learned all of the science behind this. And it was incredible and empowering, but at the same time, I went back to the old system. That's why I love what James is doing, and Tom. I wish I had met you 8 years ago. So I went back to my old practice where I had 15 minutes to see a patient, and I was miserable. I could not, with my integrity, prescribe an antibiotic and not educate you that probably dairy and some other foods may be contributing. We probably need to do some probiotics. And I got sick. I couldn't, isn't literally me, but I would go home from work and I couldn't get off the couch. And I was in what we call adrenal fatigue. So this means I had the lion in the forest, but the lion was never going away. So I was living in fight or flight all the time. I was burning through my adrenal glands. I was burning through my B vitamins, my minerals. And so I went to an integrative doctor. He drew gallons of blood. He put me on supplements morning, afternoon, evening, and bedtime. And it wasn't until I started to feel better, but this wasn't sustainable. But then I was able to leave my practice and open up my own practice. And that's where it was kind of, I had to get rid of the lion in the forest, or my own health was never going to get where I needed it to be to actually help these kids that I wanted to help. So fight or flight, what Sachin talked about is something that we all have to pay attention to, and it's the stress factor. So it wasn't until I got back to doing the things that I love to do that I could start to really help more kids. And it's so cliche, but put your own oxygen mask on first. And I think you'll hear that a common theme through many of the talks today. So I'm going to switch gears a little bit more clinical now so we can get through the rest of the information. And this, I always show this picture when I do talks. This was a family. The little boy came in. He had tics so bad that he pulled a muscle in his neck. And so when you look at him on the left, he's the classic picture. I've had so many parents come in and say, Sheila, that is my child. And he's got the pale skin, the dark circles under his eyes. He doesn't have a clear look in his eyes. And you look at the picture on the right, and it's beautiful complexion, clear skin, there are no more dark circles. So that face on the left that's called a leaky gut. That's inflammation. He's not absorbing his nutrients as effectively and efficiently as he could be. So what we do is we clean up his diet. And for him, dairy actually wasn't his trigger, but it was gluten. We took gluten out of his diet and cleaned up his gut. His tics improved by 80%. And so it was, once I had the training and really understood all this, my ability to help kids has exploded. And what I share now with families is how this leaky gut, how everything is related, just like Rangan said. It's just easier to connect the dots in kids, because if we're going to have healthy adults that live to be 117, we need healthy babies and healthy kids. So this is leaky gut, and this is a concept that it's not even heard of in conventional medicine, and I don't usually talk about this when I do talks for conventional physicians. But what we're talking about with leaky gut is the small intestine, and it has to do with the bacteria that we have in our body, the food that we're eating, and when the gut is leaky, we get these proteins that get absorbed into our bloodstream. And right here, you can't. So this on the right is the lumen of the small intestine with the cells, and there's a blood vessel below there. And what we're doing is we're absorbing proteins into our bloodstream that we shouldn't necessarily be absorbing. And that's where we get the rosy cheeks, the bumps on the back of the arms, the chronic runny nose, the dark circles under the eyes. So we have to clean this up in order to get these kids healthy. So our gut bacteria starts right as we're going through the birth canal. So if you're a vaginal delivery and you're a baby who's breastfed, your gut is getting set with the good, healthy bacteria. If you are a C-section baby and you're bottle fed, you are going to be colonized with a completely different set of bacteria. And this plays a role. The research is showing us that those kids with the C-sections, they're going to have more problems with a lot of those issues that I've been talking about. So this is the gut. So we want, that gut on the left is, that's a child who's maybe been on a lot of antibiotics, drinking enough water, they're not eating any vegetables, they're not getting adequate. And this other, the one on the right, is a lush soil, a lot of great bacteria. The gut is going to be very healthy. So those two kids get exposed to the same virus. The one on the left is going to be in bed for a week and a half with high fevers. The one on the right is going to have a runny nose for a couple of days, and they're going to bounce right back. So it's hugely important. Now the skin is a great window to the gut. This is one of my patients on the left. He's got a leaky gut. We did probiotics with him and changed his diet, and within a week and a half, he had 80% improvement of his skin and his behavior. His behavior was off the charts. And the family, the day before our last visit, for the first time was able to go out to a restaurant without him having complete meltdowns. So it's inflammation in the body is inflammation in the brain. The other sign of a leaky gut is stools. So we want to have stools should be easy, they should not take very long, they shouldn't be this huge foul-smelling event, and that's another way we monitor our patients. So when we talk about cost, these things are pretty easy to look at. And as I started to realize the things that I could be doing, I thought, why didn't I learn these things in residency? So this is when I put together the way that I think about these things. And there are 5 major things that trigger inflammation. It's food, environmental allergies, environmental toxins, infectious disease, and stress. And so what I then went on, I said, okay, I need a system. I need to make sure that I'm covering everything. So the 7 steps are an assessment. Where are we? We talk about inflammation and illness, the triggers of inflammation, gut health, food, supplements, and then the roadmap. And that's the roadmap is where we need that community. So this is now my toolbox. I use these things if I need to, but I use them far less than I used to. So can we impact our children's health? Yes, absolutely we can. We put all of these pieces together. Healthy kids become healthy adults. And this was one of the 103-year-olds that Michelle talks about. And it's the roadmap. So what I did, my solution to this was I wrote a book. I just started writing down my experiences because there were all these kids with I'm seeing kids with rheumatoid arthritis. I have a 3-year-old in my practice right now with rheumatoid arthritis. We have kids with ulcerative colitis, thyroid disease. So I created a guide for families. They can get that book on Amazon. I have an online program that families can use so that parents could have access to this globally because there aren't that many pediatricians trained in integrative medicine. So with all the work that's being done here, I would love to see Guernsey adopt this model of functional or integrative medicine so that when you go to the doctor's office, you're not worried that they're going to give you just another prescription. If you need it, great. But if there can be something else done, how refreshing would it be to know that you could partner with your doctor to get your kids healthy? So this is the message that I wanted to share with you all today. So thank you for listening.